Module 4. What other conditions are associated with psoriasis? Studies have shown that people with psoriasis are at increased risk of developing other chronic and serious health conditions. These conditions include cardiovascular diseases, high blood pressure, diabetes, high cholesterol, obesity, metabolic syndrome, psoriatic arthritis, anxiety, depression, and gastrointestinal diseases. Because people with psoriasis are at an increased risk of these conditions, they are also at an increased risk of death. Skin lesions are only one part of the disease for some patients. About 1/3 of people with psoriasis also develop psoriatic arthritis, or PSA for short. Arthritis is inflammation in the joints. Joint inflammation in people with psoriasis is caused by the immune system, resulting in pain, swelling, and stiffness. PSA often affects nails, tendons, and joints of the fingers, toes, and heels, but ultimately it can affect any joint in the body. PSA affects people in different ways. It may affect one or many joints. PSA also causes pain and swelling in tissues around joints, including the muscles, tendons, ligaments, and skin, causing tendinitis, swollen tendons, and enthesitis, pain and swelling where ligaments and tendons are attached to bone. Example, the back of the heel. Signs and symptoms of PSA include joints that feel warm when touched, pain and swelling in fingers and toes, fingers that become red, swollen, sausage-like, small holes, pits, in fingernails or toenails, fingernail psoriasis. Fingernails or toenails lift up from the skin. Less range of motion, difficulty doing daily tasks like brushing your hair, stiff joints in the morning, fatigue, tiredness. Psoriasis also has a significant impact on a person's quality of life. It causes feelings of self-consciousness, inconvenience, embarrassment, frustration, and unattractiveness in those affected.
Up until recently, psoriasis was thought to be just a skin disease disease that was red and ugly and scaly and caused a certain amount of pain and discomfort to the patient. However, we're increasingly recognizing that there are other diseases that are highly associated with psoriasis. We call these comorbidities. In particular, psoriatic arthritis. Psoriatic arthritis can affect many different joints, particularly the hands. It can also affect the hips, the elbows, the knees. And we recognize that this occurs in about 30 to 35% of the population. We also recognize that people that have psoriasis have higher incidence of hypertension. They're often overweight. They have an increased incidence of diabetes, increased incidence of depression. Also, Crohn's disease is another one that's felt to be a comorbidity. And we understand now that patients with psoriasis, particularly if they have severe psoriasis, unfortunately die quicker than regular patient populations. When I screen for comorbidities, I ask them a number of open-ended questions, particularly, has your doctor told you that your blood sugar is higher? Has your doctor told you that your blood pressure is higher? Have you gained a lot of weight in the last several years? Do any of your joints hurt? In particular, do you have some morning stiffness with your joints? Have you ever seen a rheumatologist in this regard? Also, we know that Crohn's disease can be associated with this, so again, asking questions about bowel habits, if they've ever had bloody diarrhea. So we now recognize that there are a number of comorbidities, also depression, asking whether the patient is depressed, feels that they can't cope, are also sort of leading questions that sort of find out what the patient's comorbidities are. As a dermatologist, I believe in this concept of comorbidities, and I do what I would call screening. We look at their joints, we look at whether their nails are pitted, that might indicate that they might get psoriatic arthritis. I discuss with them that there are these other comorbidities such as diabetes and hypertension. Even as a dermatologist, we do people's blood pressure. We take patients' girth, we take their weight, but I act more as a screener, and if I find that they are overweight, then I send them off to see a dietitian, impressing upon the patient that's very important, that they control their weight. I often refer them back to their family doctor and say, listen, we understand that blood pressure can be a problem in patients with psoriasis, that diabetes can be a problem, and so I often have done blood work and screened for these things. Unfortunately, as a dermatologist, I do not have time to manage these in addition to all the skin disorders that I deal with. So I send them to the right person. So sometimes this may be an internist, a cardiologist, a dietitian, an endocrinologist to get their help.